Hello everyone, I welcome you to today's broadcast. In today's we're going to talk about leadership in health, that is health leadership. Health leadership. Why health leadership is important? Because there is leadership in everything. There's family leadership, there's organizational leadership, there's church leadership. So there is a need for health leadership because the quality of the leader determines the outcome and an increase in that particular organization. Before then, I'm Oka John. I welcome you to Health Pulse and Popo Hub Academy. And today we're going to talk about leadership. Why leadership is important in health? Because leadership saves life. Leadership brings about increase in health center. Leadership brings about reductions in morbidity and maternal death of diseases across our health lines. So in this broadcast, I want you to pay close attention as I'm going to unveil some certain cases. We begin. Let's look at what is health leadership as a concept. Health leadership is the ability to influence change, influence systems, and bring about positive outcomes in health. Health leadership means possess the unique view about health. What is that you are seeing that others are not seeing? You want to see life safe. You want to see diseases have been maximizing in the community. You want to see children be vaccinated. You want to see that the rate of increase of diseases is being managed. You want to see disease epidemiology, disease control. That is leadership. So leadership is about enforcing a change in healthcare setting. Leadership is about bringing positive outcomes to a community. Leadership is about increasing the community, enforce laws that make a community to making positive decisions to bring about good health outcome. That is leadership. Leadership is not about maybe heading a facility and so on and so on. Some of these things that happens across PSC settings. But leadership is beyond. Leadership is to see beyond what others are saying. That is leadership. So that is what the concept of leadership. What others are saying. That is leadership. So that is what the concept of leadership. Why does health leadership is important? Somebody might ask that question. Health leadership is important because there is not PSCs, there is no hospital that don't have a leader. That is where in PSC settings there are places of facility in charge, OICs. In hospital there is medical directors, that is CMDs. So leadership is important because there is decrease in healthcare settings. You see primary healthcare services is falling down, and as a result of that there is a need for leadership. Leadership is important in health because of decisions making. It is when we begin to have good leaders in healthcare settings, people that make decisions that bring about development, people that make decisions that bring about positive outcome, people that make decisions that bring an increase in disease management. That is what health leadership is important because it helps in the involvement of community. That is why there is places for village or development committees. The leadership, it will help to be able to handle all of this. As we proceed, I want to explain the different types of health leaders that we have, or different categories of health workers. I will begin by saying there are terminal leaders who started but they could not continue. Leadership with limited mindset. There are terminal leadership. Have you ever seen, this so person was in charge of the particular facility and so on and so on then, and at the end of the day there is nothing that can be traced to the person. Even when he's retired, what he was saying himself, there was no place for impact. There is no place for him to transfer himself even to the life of a younger generation. The person was just optimistic. He was just seeing himself here and OIC and so on and so forth. There is no impact, and those type of people, they are what terminal leaders. Then the second category, which I call them generational leaders. Generational leader, it means these are people that they only when they are done with their services, there is nothing that can be traced to them, and there is what is called transgenerational leader. These are people who do things that even when they are no longer alive, there is something that is traced to their life, and those are the people we really need in health setting. This is not people that they are making decisions or maybe because of what they can get or what government can offer to them, but these people, they see different, they are visionary, they are seeing different, they are seeing how the rate of diseases in the community to be maximized, they are seeing how things needed to be done. These are the people that some of them, it reach to a level they undergo training to themselves, or training on reception, how to receive client, how to receive patient, how to manage patient. It trains his leader even on attitude. How does his staff supposed to be behaving? These are transgenerational leaders. All these are transgenerational health workers, and that is why in this podcast I want you to pay close attention, because I am going to unveil some certain secret that it will help you to become more effective health worker, because leadership is important. There is leadership. Leadership is everything. When a particular organization there is an advancement, there is an increase, that means there is what good leadership. And I want you to pay attention. The 5 pillars of health leadership. 5 pillars of health leadership. Which number 1, I call it knowledge/transformational leadership. These are people, these are leaders who has continuous learning. They are updated knowledge about where the earth is going. That is why some of these people, you might be surprised. You ask them a question, what is the current update in health? They don't know. The only thing, just being a facility and doing some certain thing on some of these programs. That is why sometimes I ask myself a question, like some of these programs, surveillance programs, with all these programs we're doing, and common polio is a lie. Polio is not eradicated in Nigeria, and it is because of poor leadership. Some of these vaccines in themselves, some of the children are not being vaccinated. You might hardly go to a community. There are so many children, 0 dose, a lot of things, they have not been vaccinated. How are we going to conquer preventable disease with this type of leadership? So leadership, transformational or knowledge leadership, and leadership who have a continuous knowledge. They are continual learning. They are updated about the current happening. What is the disease epidemiology, the disease control, and so on and so forth. Number 2, the type of leadership. We're going to talk about the ethical leadership. These are leadership with what? Integrity. They don't compromise their standard. It is ethical leadership. They're doing their medical service unethically. They don't cut standard like some of these quack practices in earth. Once you become a leader, you already knew that every other things you are doing, you are not just doing for yourself. There are many people that are watching you. So you are going to avoid quackery work. You make sure that you do everything according to standards of operation. They call it SOP. So that is what ethical leadership. Ethical leadership, they are integrity. They are people that they don't compromise their standard. Their yes is yes, whatever they say. That is what you are going to meet it. That is what ethical leadership. So it's one of the pillars of leadership. Compassion leadership, these are people that they don't just treat sick people as cases, but they treat them as people. They render compassion to patients. They are caring. They are not annoyed with patients. So until we begin to emulate these pillars of leadership in health, we might not be effective. So there is a need for compassionate leadership. When we render services, a patient you are touching, you are seeing the patient as your child. You are seeing your patient as your relative, not just somebody outside that you might do things the way you want. That is what compassionate leadership. Until that is why you get to understand that health, what like medicine, and medicine in itself is something that is spiritual, because it's compassion in its place. When as a health worker there is no compassion in you, you are annoyed with patient, you are annoyed with the way the patient handles it, there is a problem in leadership. And leadership, community leadership, as a health worker, is talking about, as a health worker, how you be able to involve the community to make decisions to solve their problem. Like for instance, you are in a community where there is an outbreak of a particular disease. What you need to do is to want to implement your community leadership to be able to seek the concept of the community leader. What do we need to do in order to prevent the particular disease? That is what community leadership. So health is not just about giving injection. It's not just about giving drugs. There are many things that it involves in health setting, and community leadership is very, very important. Leadership in itself, it's not just about positions, but it's about what? Sacrifice. Health leadership is not about position, but it's about sacrifice. Health leadership is about bringing a change to a community. So in today, if you want to make a sustainable impact in health setting as a leader, you need to start today. Keep learning, advance your community. Now, as we conclude, don't forget to follow all our YouTube platform and Facebook, HealthPro and Popo Hub Academy, for subsequent video. What area do you want to go? I want you to comment on the comment sections, as I'll be able to release a video for you to go and watch to be improved. Thank you. Bless you.